Hello, my name is Sandra Lopez. Today I will be talking about cocaine. What is cocaine? Cocaine is a powerfully addictive stimulant drug made from the leaves of the coca plant native to South America. Although healthcare providers use it for valid medical purposes, such as local anesthesia for some surgeries, recreational cocaine use is illegal. As a street drug, cocaine looks like a fine white crystal powder. Street dealers oftentimes may also mix it in with other drugs such as stimulant amphetamine or synthetic opiates. Other names it goes by are coke, rock, snow, blow, white, nose candy, base, flake, powder, and smack. How is cocaine used? People snort cocaine powder through their nose or they rub it into their gums. Others dissolve the powder and inject it into the bloodstream. Some people inject a combination of cocaine and heroin called speedball. Another popular method of use is to smoke cocaine in a pipe that has been processed to make a rock crystal. The crystal is heated to produce vapors that are inhaled into the lungs. This form of cocaine is called crack. Some people also smoke crack by sprinkling it on marijuana or tobacco and smoke it like a cigarette. How does cocaine affect the brain? Cocaine increases levels of the natural chemical messenger dopamine in brain circuits related to the control of movement and reward. Normally, dopamine recycles back into the cell that released it, shutting off the signal between nerve cells. However, cocaine prevents dopamine from being recycled, causing large amounts to build up in the space between two nerve cells, stopping their normal communication. This flood of dopamine in the brain's reward circuit strongly reinforces drug-taking behaviors because the reward circuit eventually adapts to the excess of dopamine caused by cocaine and becomes less sensitive to it. As a result, people take stronger, more frequent doses in an attempt to feel the same high and to obtain relief from the withdrawal. What are the risks and consequences of cocaine? The short-term health effects of cocaine include extreme happiness and energy, mental alertness, hypersensitivity to sight, sound, and touch, irritability, paranoid, extreme and unreasonable distrust of others. Some people find that cocaine helps them perform simple physical and mental tasks more quickly, although others experience the opposite effect. Large amounts of cocaine can lead to bizarre, unpredictable, and violent behavior. Some long-term health effects of cocaine depend on the method of use and include the following: snorting, loss of smell, nosebleeds, frequent runny nose, and problems with swallowing; smoking, cough, asthma, respiratory distress, and higher risk of infections like pneumonia; consuming by mouth, severe bowel decay from reduced blood flow; needle injection, higher risk for contracting HIV, hepatitis C, and other blood-borne diseases; skin or soft tissue infections, as well as scarring or collapsed veins. Other health effects of cocaine use include constricted blood vessels, dilated pupils, nausea, raised body temperature and blood pressure, fast or irregular heartbeat, tremors and muscle twitches, and restlessness. Can a person overdose on cocaine? Yes, a person can overdose on cocaine. An overdose occurs when a person uses enough of a drug to produce serious adverse effects, life-threatening symptoms, or death. An overdose can be intentional or unintentional. Death from overdose can occur on the first use of cocaine or unexpectedly thereafter. Many people who use cocaine also drink alcohol at the same time, which is risky and can lead to overdose. Others mix cocaine with heroin, another dangerous and deadly combination. Some of the most frequent and severe health consequences of overdose are irregular heart rhythm, heart attacks, seizures, and strokes. Other symptoms of cocaine overdose include difficulty breathing, high blood pressure, high body temperature, hallucinations, and extreme agitation or anxiety. Getting help. The only way to prevent cocaine overdose is to stop using cocaine. Those who continue to use it will notice that their cocaine tolerance builds quickly. As tolerance mounts, people often begin to exhibit binge patterns of use, which can develop addiction and furthermore greatly increase their risk of overdose. Treatment for cocaine abuse will help users identify the thought patterns and behaviors that trigger their use and practical methods to help resist the urge to use. It can also help a person examine their own personal reasons for turning to cocaine abuse and how they can practice healthy coping strategies for future relapse temptations. Behavioral therapy can be used to treat cocaine addiction, Examples include cognitive behavioral therapy, therapeutic communities, or community based recovery groups such as 12-step programs.